everyone. How are you this evening? Kourtney and Bryan here. We are coming on tonight to talk to you guys about falls in the elderly and some cool things to do to help prevent them and to make the house a safe place and all kinds of fun stuff. So I am going to hand it over to Bryan to get started, and then I am going to come in and talk to you guys about CBD for pain and sleep. So Bryan, take it away.
Perfect. Well, it's a pleasure to be here. Pleasure to speak with everyone and to have this platform to be able to spread some education about falls in the elderly, typically adults over the age of 65. Do want to talk about how falls or the act of falling in the home or outside the home, wherever, if it happens at the store, if it happens on a walk, it is something that we all need to start thinking about as we get older. Falls are one of the top two reasons that people end up in the hospital and return to the hospital. And it can be the risk of it can be mitigated by a lot of different factors, a lot of things that you can change in your home, simple things to be doing. And we'll talk about some of those things today. One of the things that we notice, and I work in home care. I'm a director of marketing for a home care company, but I have a lot of experience with seeing little things in homes that have caused falls for people where they otherwise wouldn't even think that these things would be doing that, such as throw rugs. Throw rugs are something that a lot of people have in their homes, whether it's in their, in their kitchen or in their living room or in their family room. The elevation of that throw rug, even if it's at such a small amount, even whether it's like an inch or if it's just a small amount of elevation from a throw rug, can actually catch under somebody's foot as they're walking onto that rug or over it. And we see those being one of the huge reasons that people will have a fall in their home. So I know that a lot of us want to keep our throw rugs. It might be a family heirloom passed down from grandma or great grandma. Been in the family for generations. But as we get to the point where we are off balance and we start to understand that we're developing a fear of falling, this is one of the main reasons that people do have falls in their homes, are that little bit of elevation, usually caused by a rug, or if it's a step. A lot of times it's like a single step that comes from going into the kitchen or coming in or out of a room in the house. Those things become obstacles in our way, and certainly huge risks as to why falls do happen in the home. One of the recommendations that I can give to people to kind of be aware of their surroundings so that they don't have a fall at home is, if you are losing your balance, if you are having that fear of falling, don't try to use things in your homes like ledges, edges of tables, towel bars in the bathroom to use your balance. Don't put your weight on those things, because you have no idea if they're going to break or if they're going to rip out the wall, if they're going to slide off the end of the table. You can certainly put some fail safes in your home that are actually that pertain to safety, that could be installed by an occupational therapist, that could be installed by a medical device company. Things such as installing railings that go up the steps, grab bars in the shower. A lot of times people put a seat in the shower. You can get a seat at great places like Professional Pharmacy. Yes, they actually sold one tonight. I watched that happen. The guy came in to get one for his shower, and it's a great thing. The seat in the shower as a device for somebody who doesn't have good balance is something that is going to most likely prevent a fall from happening in the shower. I know I wouldn't want to have a fall, especially not have a fall in the shower. That would suck. Yeah, these are some simple things that one can do, just as far as changing some things in their home so that they know they can be more safe and be at less of a risk of having a fall. Um, and that's also going to build their confidence and build their um, their just better quality of life, have less of that fear of falling. And we do know that the fear of falling can start to snowball out of effect for people's well-being. If we're afraid that we're going to have a fall, that's going to stop us from doing a lot of activities of daily living that we otherwise would be doing if we didn't have that fear. So it's something that I believe that many people can overcome very easily just with a little bit of help, a little bit of education about how to mitigate these things throughout their life, and to just make some changes in their home. If there's any information that you would want more, or if there's any more information that you would want on how to make some of these changes in your home, you can certainly call us at Family Caregivers Network. We are right next to Professional Pharmacy here on Main Street in Pennsburg. Our telephone number is 215-541-9030. You can ask for me, I'm Bryan, or you can just ask for any information on how to be more safe at home. Somebody will help you if I'm not there. One of the office staff will be there to answer your call and to answer your questions.
Awesome. Such great information, Bri. We see a lot of this in the pharmacy every day. People come in, or their families come in for prescriptions if they've fallen and broken something. And it's preventable. It's 100% preventable. And sometimes there are things, like you said, throw rugs, things you don't think about or grabbing onto something that's not sturdy. And it's scary. It's truly scary. And it's good for both the patients themselves, as well as their caregivers, their family members, to be aware of as well. So some of the things that we do in the pharmacy is to help our aging population is, you see a lot of this occur when they take their medication. So if they're taking medications that they can be cognitively impaired, such as pain medications, opioids, or any kind of sleep aids, most of them can impair them, and for long term for the night. But if they have to get up to go to the bathroom, which a lot of people do in certain age ranges, they need to get up. And at that point, they're still not kind of cognitively okay. And a lot of falls happen in time to their medications. So one thing that we do recommend that is a fantastic product for many different things is CBD. For those of you that don't know, to kind of give you a quick breakdown of what CBD is. CBD is cannabis. It comes from the cannabis plant. It works on our endocannabinoid system, and it works for so many different things. Right now, we're focusing on just kind of like pain and sleep, but it works on this system, which creates a homeostasis in the body, which is why it works on so many different things. Anything from anxiety and depression to migraines, seizures, pains of all type, restless leg syndrome, you name it. It really, really does work, both taking an oral tincture, capsule, or a topical product. We sell a lot of those here in the pharmacy, and a lot of people are switching over to these products. They're willing to give them a try. They just became, CBD 5 years ago was kind of like what is that? Is that legal? That's cannabis. But it's turned into just an over-the-counter product that's just, you can get just like you get Advil. It does not cognitively impair you, the products we sell here. You would want to get a full spectrum CBD, which has 0.3% or less of THC in it, which is the component that could cognitively impair you. There are such small levels, they cannot actually cognitively impair you. So basically how these products work, they work in our endocannabinoid system. We have receptors in our body where they bind to, and CB1 receptors are in your brain. That's where the cognitive impairment happens. That's where the THC binds. All of the other cannabinoids that do great things for the body including being an anti-inflammatory. So it works for a lot of different kinds of pain, restless leg syndrome, that sort of thing. So it regulates that, and it successfully helps a lot of people either cut down on opioid or pain medications or go off of them altogether. And it also works fantastically for sleep. That's actually one of the first things people say, no matter what they're using it for across the board. They say, oh my gosh, I'm sleeping like a baby. So it's fantastic for sleep. And if you wake up from it, if you wake up in the middle of the night to use the bathroom and you feel like you can't fall back asleep, you can go ahead and take another dose. And usually people fall asleep within anywhere from 10 minutes to a half an hour when taking it, which is pretty awesome. And it's not that you get a, loopy, groggy kind of feeling. It just kind of shuts your mind off, helps you relax and go to sleep. So our recommendation is to use products like that rather than any kind of controlled substance or even a Benadryl products, any kind of PM product you see, Advil PM, Tylenol PM. The PM in that product is just Benadryl, basically. It's diphenhydramine, and it's just the side effects that cause severe drowsiness. And again, even though it's not a controlled substance and it's not something that might cognitively impair you, it can make you super, super tired to the point where you're groggy when you wake up to go to the bathroom in the middle of the night. So CBD is fantastic for sleep, highly recommended. You can come in at any time and talk to any of our pharmacists about dosing. The idea of CBD is to start low and go slow and just kind of play around with dosing until you find what works for you. Sounds kind of funny as a pharmacist saying that, used to giving an exact dose, frequency, that sort of thing. But everybody is different. They're a bio-individual with CBD. So the idea is to start with a low dose and kind of find out what works for you. And that's what we're here at the pharmacy. We can help you pick the right product, whether it's a tincture or a capsule. If you're using it for pain, there's also topical relief as well. But we can walk you through that if you come in and just ask for one pharmacist. We can help you with that.
I think that's great. That's great information. I've certainly learned a lot about this holistic or new alternative form of intervention for pain management or for people dealing with any chronic pain. That it's great to learn about. It's great to know that these forms of remedy are out there, and because you see, I'm dealing with, working in this industry, in the elder care industry for so many years. I can't tell you how many times I've seen people have problems with their meds because it's either they're on too high of a dose and it's a very serious narcotic or a painkiller, and they'll have a fall because of it, or they'll have an issue, an event that will happen, and then they end up back in the hospital. So learning about these holistic ways of managing pain through the CBD products that you guys have, it's a wonderful thing that you guys are doing, and I'm just eager to learn more about it and how we can work together with helping our patients and helping the community here in the Upper Perkiomen Valley, with knowing that there is other ways of managing pain, and healthier ways and more effective as well as safer ways of managing that chronic pain. So
absolutely.
Yeah.
And it's, and like you said, it's all about education. A lot of people, the big thing a lot of people don't even realize is that endocannabinoid system in our body, that's just as important as every other system in our body. It's our body's homeostasis, which is why CBD works for so many things. It's still only taught in like 13% of universities. So all of these new doctors, pharmacists, nurses, they're not even learning about it in school. So it's everybody who is learning and kind of becoming privy now that it's becoming a household name. CBD, what's that? It's really a self-education kind of thing where, you learn, and I try to make it my priority to, teach our customers on the daily. If they're asking about it, I give them a small education when they come in to purchase. Prior to COVID, I ran a monthly class, teaching about CBD and how it works. And we dove in deep and talked all about it and had question and answer sessions. But unfortunately, it's hard to get the crowds back with COVID. Hopefully, maybe once the winter's over and seasons warm up, we'll get back to our normal and can really educate and get people kind of knowing and learning and giving it a try. Because I can tell you that over the past 5 years doing this, I have hundreds of written testimonials from clients from anywhere from, anxiety and depression to pain relief, even helping with animals and pain relief and anxiety. So many different things that it can be used for. So education is everything on both ends.
Yeah, I think, the more that we get that education out there, we're seeing the stigma be lifted off of CBD, that stereotype that, oh, it comes from the same plant that marijuana comes from. But that as the more that people can understand that it is not the marijuana, it is not that side of that plant. There's actually that medicinal purpose that comes from CBD alone, and that they're not going to feel loopy. They're not going to feel like they've taken some sort of drug. With taking these things,
It's
they're
true.
actually going to feel relief from their pain. That education is paramount in being able to help people understand that these tropes or these stereotypes or these stigmas that come along with it are just something that is just talk. It's just hoopla. And I think that we don't quite know what we're going to do with this video yet. It's kind of just impromptu, whether it's going to go on our social medias or if it's going to go on LinkedIn. We can keep doing things like this. We can certainly do face-to-face seminars. We've talked about trying to, get some of these together, whether it's, unsuccessful at one place or successful at another. The more we can get these videos out there and get positive feedback on them, the more we can engage with you and find out who would like to come and attend the seminar that we're doing. We'll just keep doing it.
Absolutely.
Yeah.
And we can do it on any level. We have different levels of classes when we know our audience, if whether whether you're a clinician and you would like to learn more about falls and how to prescribe CBD to customers, or whether you're a caregiver, family member that wants to share with one of your, either your elderly family members or just anybody of any age. This seminar can be definitely tweaked to whoever needs it. So there's a lot of people that could use the help from that we have to offer. So if anybody wants to get in contact with us, again, I work at we're neighbors in our community. So I work at Professional Pharmacy, and Bryan works a couple of doors down at Family Caregivers. So we have the same customers that are coming back and forth to both of us, looking for help. So we can certainly get out into the community. Hopefully people in our community will see this, recognize our faces, and reach out, because we would love to educate you guys and help you with whatever you need.
Yeah, you have that support. You have the support from us, and we'll be here. So contact us, contact Kourtney here at Professional Pharmacy, contact me at Family Caregivers Network, and we hope to see you guys and talk to you soon.
All right, everybody, hope you have a great night. Thanks for watching, and we hope to talk to you soon. Bye. Peace out.